Hello, everyone, and welcome back. Today with us, we have Kate Waters, and Kate is an intimate health specialist and nutritional therapist. She supports women of all ages with chronic and ongoing vaginal, bladder, or vulval issues, and really focuses on supporting women so they can take control of their bodies and feel empowered rather than dominated by their symptoms. And Kate really takes on a holistic full body approach. And today we're going to focus particularly on menopause and how this relates to vaginal symptoms as well. And so I think it's a really interesting topic that I know a lot of people struggle to manage and struggle to know what to do with. So yeah, really important. Thank you, Kate, so much for coming on, and welcome.
Thank you.
And I think, as I always start all of these, I'd love to know just a little bit about yourself and how you kind of got into the space, and just to kind of know a bit about your background.
Sure. So I was a chef to start off with for around
Oh,
about
wow.
20 years. And I myself was very ill, but I discovered that I was celiac and I changed my diet and my lifestyle and realized how important food and diet was to health. My hormones and microbiome, though, were in all areas were out of balance. And so I
Mm,
started studying nutrition and I worked really hard with various practitioners on sort of bringing my body back into some state of balance. And this was from nutrition through to acupuncture and English herbs and Chinese herbs. And then I qualified in a state of health, which was good. And I started specializing in gut health, but I'd always loved working in with women's health issues. And
mm,
at first I thought I'd step into fertility. But after I had my son, another nutritional therapist friend of mine she'd been seeing a lot of bladder clients and she was going abroad. So she handed me some of her clients and the opportunity to step into her shoes to do some talks with some charities. And I jumped at the chance and my love for intimate health was born. And then about a year or two later, microbiome testing started to become more available. And I tested my own vaginal microbiome and was amazed at what I found. It was not what I was expecting at all.
mm.
And through one of the companies that I was using, I discovered Maura Bradfield of Intimate Ecology in Australia, and I studied under her. And it was a bit like a light switch going on in a dark room. I suddenly was able to understand the microbiome to a deeper level and what was going on with my clients, and therefore able to support them much, much further than I had been before. We weren't just relying on swabs from doctors, which can be very limited in their information. And so I've been specializing in this field now for around about 5 years, and I only see intimate health issues in my clinic. Obviously, if someone's got a thyroid issue or a gut issue, I'll be dealing with
Mm.
that as well. But the focus has to be that somebody comes to me with intimate health issues. It's my absolute passion and my mission to improve intimate health for any women out there that need it.
Well, that's such an interesting story and progression. And I think, yeah, that's amazing that you've kind of found your niche that you really want to focus on. And it's such an expanding field as well. So I think that's really important
Absolutely.
and something that more and more people are going to suddenly be switched on and be interested in. So that's really cool. And I think, just to start, because our kind of topic is related around menopause, I'd love for you to just give a brief like outline and just talk about perimenopause and menopause and the changes that may occur, particularly with relation to intimate health.
Sure. So the lead up to menopause is called perimenopause, and this is the time when our hormones are starting to fluctuate and change after our fertile years. And this can last anywhere between 4 and 12 years. So it's quite a long period of time. It's a bit like a second puberty. And it's different for everybody, just like first puberty was. We will all experience it, in a different way.
Mm.
Menopause is when you've had 1 year of no bleed. So it literally happens overnight. Suddenly, you were perimenopausal and then suddenly you're postmenopausal, or you're menopausal overnight and then postmenopausal. The average age is around about 52, but it can be anywhere between sort of 45 and 55. You can have early menopause at any time, or a surgical menopause as well. And during peri, the hormonal changes that occur, so progesterone will start to drop off and it very, very slowly kind of tapers down and off. Whereas estrogen bounces up and down, which is what it causes quite a few of the issues, is this kind of fluctuation that's
Mhm.
happening. And testosterone will lower as well. And eventually we'll end up with low levels of all of these hormones. The change in hormones is what causes the symptoms. So things like disruption to sleep or an inability to go to sleep, anxiety, energy issues, weight gain, mood issues, bone density issues, cognitive function may become impaired. So things like memory, forgetting words, forgetting what you've walked into a room for, body temperature dysregulation, hot flushes, things like that, your cardiovascular health, drier skin. And in fact, all the mucous membranes can become drier. So eyes, mouth, urethra, vagina. But it's really important to note that we don't all get all of these symptoms. And your health and how your hormones have been and how balanced your blood sugars are and how stable your microbiome sites are and how stressed you are, all of that will impact this stage of life and how you experience it.
Yeah, no, that's a really nice and great overview, I think, of all the different symptoms. And I think, yeah, that's really important what you said about how it's different for each individual. You shouldn't have to, there's not a checklist, so to speak, that you have to have all of these to be menopausal. Everyone, as puberty itself, you completely right, everyone experiences these differently. And I think that's something that people don't always realize or recognize. So they it's often associated with, say, with hot flushes, for example, and it's like, well, I don't have them, so I'm not perimenopausal. But actually, there's so many other symptoms that are not quite as well known. So I think that's really important of highlighting all of them. And I think you've mentioned quite a few of these symptoms, and I'd love to know, because our focus is kind of on intimate health today, I'd love to know a bit more about the vaginal and vulval symptoms that can experience.
Sure. So they've all been grouped together under a title now of genitourinary symptoms of menopause, or GSM. And what we're seeing there is vaginal, bladder, vulval, and sexual symptoms. So vaginal symptoms might be things like vaginal dryness, vaginal irritation, burning, itching, pelvic pain or pressure in the vagina, prolapse, a persistent and recurrent discharge with odor. And a lot of those can lead on to sexual symptoms, so uncomfortable or painful sexual intercourse, decreased lubrication during sexual activity, and that comes back around to the vaginal dryness side of things as well. Light bleeding after sexual activity, and again, this comes back to the dryness, friction. Obviously, there's a lot of movement and impact with sexual activity, decreased arousal and loss of libido, which can be very linked with the lowering of testosterone. Vulval symptoms, so hypersensitivity or decreased feeling in the area, burning sensations in the vulva, and the vulva is obviously the external part of the tissue around the vaginal opening and up to the clitoris, so the labia, and weakening of the pelvic floor in the vulval area, changes to the structure and thinning of the skin there. And then there's also an increased risk of something called lichen sclerosis, which can appear at any stage in life, but it is more often found in menopause or pre-puberty due to the low estrogen status. And then there's urinary symptoms as well. So burning or painful urination, frequency, urgency, urinary incontinence. So whether that's stress incontinence or just urge incontinence, recurrent urinary tract infections, and prolapse in the bladder or urethral area as well.
Mm-hmm. Yeah, that's a whole range of symptoms there. And I'm sure that, yeah, that will help a lot of people kind of identify issues and concerns that they may have. But for those who don't understand it, and yeah, for myself, why do these symptoms of GSM occur? What is the science behind what's happening here?
So all of the hormones play a role in this. There's a lot of focus on estrogen, particularly with HRT. Quite often doctors will only give progesterone out to protect the uterus from cancer, but it's an important one as well. And testosterone, as I mentioned before as well, plays a role in all of this too. But estrogen is the main one that's focused on because estrogen plumps the tissue, it keeps it nice and elastic, and it supports glycogen production, which is excreted from the walls of the vagina, and it feeds the vaginal microbiome, helping to keep the vagina lubricated. So as estrogen decreases, so do our lactobacilli strains. And our lactobacilli are really important because they create something called lactic acid and hydrogen peroxide. And this is what keeps our vagina a nice acidic state. So it's a pH of around about 3.8 to 4.5 as a sort of given healthy state for the vagina to be in. But with this loss of the lactic acid and hydrogen peroxide, we may find that rises above the 4.5. So the menopausal vagina is very similar to a pre-puberty vagina in terms of alkalinity. And in some instances, other bacteria may grow up in that space because it's not an empty space. So when the lactobacilli die down, something else may grow in its place. I always like to think of it like a pie chart. If you knock out sort of 40, 50, 60% of that pie chart, it's not going to stay empty.
Mm.
Something else will come in. So our most beneficial ones that we, or sorry, the lactobacilli species that we think of as being in the vaginal space are Crispatus, Gasseri, Iners, and Jensenii. And these are the ones that we find that dominate the vaginal space. And in particular, some of them are more beneficial than others, but they're all seen in health as well. And a change in the vaginal microbiome can have an effect on vaginal dryness, on sexual health, and even on atrophy as well, although it's much more to do with the loss of estrogen to do with atrophy. It's the same for the vulva as well. So the plumpness of tissue and atrophy of the structure. There can also be an aching from the hormone receptors. They no longer get enough hormone to them. This is sort of lock and key system where they go into the cells, and they can kind of ache and almost burn sometimes if they're not getting that. An overgrowth of pathogenic or inflammatory microbes can cause irritation and burning sensations sometimes. And one of the big ones for causing burning is Enterococcus faecalis, which I often see when there's a burning presentation, either internally in the vagina or externally on the vulva. HRT can also increase fungal presentations in some people, and HRT is absolutely brilliant. I'm not saying this as an anti HRT thing, but if you have experienced lots of thrush or candida before menopause, or if there is blood sugar dysregulation, you may find that you suffer more from candida overgrowth when you start taking HRT. And this is just to do with the relationship between estrogen and the glycogen being produced and the candida. In the urinary system, the loss of hormones and the change in the microbiome can lead to thinning of the urethral epithelium, so the sort of tissue lining of the urethra, and also the bladder lining as well. And a change in the microbiome can cause an overgrowth of pathogenic bacteria. So the bladder microbiome was very newly discovered in around about 2012, and we're slowly learning more and more and more about what's going on in that space. But it seems that lactobacilli strains are as beneficial as they are in the vagina as well. And that's what we want to sort of be looking at. So when we see the loss of them, then we start to see an overgrowth of these other strains and more UTIs, for instance, or UTI symptoms.
Yeah.
So there can be issues with the structure of the bladder and the urethra, causing more frequency and urgency. So thinking of prolapse or just things not being held up quite so well in that space. So there's sort of multifaceted issues going on around all of this. And my role clinically is to try and work out what's going on for you as an individual and to try and resolve your symptoms from that.
That's, yes, a wealth of information there. So I think that's all so interesting. And I think, as what you said there, the individualized approach is obviously so important, because you kind of briefly mentioned, for example, the different lactobacilli species, and the composition of them can mean completely different things.
Absolutely.
And there was a research paper that came out recently that was talking about how there's different profiles associated with different things. And I think that's why it's really important to, if this is something you're dealing with and concerned about, speak to someone that kind of knows what these different balances and what these different species do, and whether they're dominating or whether they're not dominating is also important, isn't it?
Absolutely. You know, we have these community subtypes or these kind of given profiles that are seen in health. And the trouble is, quite often when people are testing their vaginal microbiome, they're actually not in health. So it's really important that we kind of gauge, is this, you know, your normal or beneficial state, or is this something that's actually causing a problem for you? And it's a really great way to unpick and to discover what's going on there rather than making presumptions. And we're just learning so much. It's sort of like we're riding the crest of a wave at the moment. There's just so much left to uncover in this space, which makes it such an exciting place to work.
Yeah, completely. No, it's very exciting. And I think also it can be intimidating hearing all these things and all these changes that are going to happen as you enter into menopause. But as you've alluded to, and as we'll come on to later, there are things that you can do to improve this and to manage these symptoms and to really work towards better health. So I think this is something that people can hear that and be like, oh my gosh, no, I'm really scared. But it's not, this is why it's such an exciting space, because there's so much that we can do and that we're learning to do.
Absolutely.
So I think that's really great. And kind of related to that as well, I think, why do you think we're seeing a rise in these symptoms being like spoken about, and what other conditions, you kind of mentioned prolapse, but what other conditions we more likely to see as we enter into menopause?
So I think, we're seeing a rise in these symptoms and these conditions more and more in women because they're actually speaking up. Whereas before, our mothers, our grandmothers, they brushed it under the carpet and suffered in silence. More women are continuing to have sex as they transition into menopause as well. They're not just stopping as many women did in the past. We've got better lubricants. And even men as they age now have more ways in, things like Viagra to keep them going as well. So I think that there are, reasons why we're seeing more of this. But the biggest one, I think, is because people are actually speaking up now, whereas they were staying silent before. But with more sexual activity, when the tissue is not as plump and robust, it does become more fragile potentially. And so we may see more tissue damage and more transferal of microbes as well, particularly if couples are not using condoms, because there's no threat of pregnancy. And obviously that is not the only birth control method out there, but it is one that's used quite a lot. And then suddenly it stopped being used. And we see a transferal of microbes a lot more in that case because of the seminal fluid. And because that has its own microbiome as well. And the seminal fluid is a pH of around about 7.2 to 7.8, which is much higher than we want the vaginal pH to be. So let's just say in a postmenopausal woman, the pH is already going to be a little bit higher than 4.5. It's great if it is around 4.5, but we quite often see it up around 5 to 5.5. That could then get pushed much higher. And if that's continually pushed much higher, it can actually push things over the edge a little bit, and we'll find more microbes growing in that alkaline space rather than if it was more acidic, a more acidic space. So sex can really upset the balance. Not that it's something to stop doing at all. I think it's really important that we keep going and we keep empowered if that's what we want to do. But it's just about being aware about all of this, I think, because if you're aware, you have knowledge, and then you can do things about it. In terms of the conditions that we see related to the symptoms that I spoke about earlier, and obviously I'm not a doctor, I do not diagnose, but these are the things that people come to me with. So pelvic floor issues, and this is a really important one because this is critical support to the pelvic organs like the bladder, the uterus, the rectum, and the muscles sort of cradle these organs and play a huge role in controlling urination and bowel movements. So we might see weakening of the pelvic floor muscles because estrogen really helps to maintain the strength and elasticity of the pelvic floor muscles, and that obviously dwindles during menopause. And due to this, we may then see things like urinary symptoms like the stress and urinary incontinence or increased frequency. And due to the pelvic floor weakening, we might see a lead to the descent of the pelvic organs, so that prolapse that I mentioned earlier. And this can cause discomfort or pressure, either in the pelvic region. A vaginal prolapse might cause a dragging sensation or a feeling like there's something in there, like a tampon in there. And you can even get urethral prolapse where it sort of pushes through to the vagina as well. So that's something that can be worked on quite easily. Well, easily. It can be worked on with a pelvic floor specialist though. So it's something that we can actually access and do something about. Then there's vaginal atrophy or atrophic vaginitis. And this is one of the most common complaints for many women entering menopause due to the decreased estrogen levels. And this can occur even when estrogen is low or hormones are fluctuating throughout women's lives. So perimenopause, obviously, but in some cases, even during pregnancy or breastfeeding when there's lower estrogen status, because the estrogen affects the thickness and elasticity and moisture of vaginal walls. And this might result in obviously lower estrogen, meaning lower lactobacilli strains. So then we get less lubrication. Now, lubrication doesn't just come from our lactobacilli, it also comes from the vaginal wall and the cervix excreting liquids, but all of that again comes from the plumpness of the tissues. So low estrogen, we're seeing less lubrication happening. Thinning of the vaginal walls means heightened sensitivity, which might cause itching and discomfort, and that can really impact our day-to-day life, things like walking or exercising. Painful intercourse due to the fragility of those tissues. Sorry, excuse me. And we might even get irritation and micro tears due to those thinner walls and tissue there as well. And therefore, there can be a risk of higher infection as well, whether it's due to these small tears or due to the change in the pH, as we mentioned earlier, and the risk of pathogenic or inflammatory microbes taking over. In turn, that can then increase the risk of urinary tract infections, which we'll come on to, just because of the close proximity of the vagina and translocation to the bladder from the vagina to the urethra. So UTIs are an issue for all women of all ages, unfortunately. But in the context of menopause, if you've had a history of urinary tract infections, it may indicate that there might be a predisposition to recurring infections.
Mm.
But UTIs can also occur for the first time during perimenopause as well. So there's no sort of set given, oh, I've had them in my 20s, so therefore I'm definitely going to get them as I go into menopause, or I've never had one, so I'm never going to get them. Unfortunately, there's no sort of set rules around it, but you definitely see quite a pattern of women who've had them in their 20s or through their lifetime, getting more of them as their hormones shift. And this again is because of the decline of the hormones, particularly estrogen, and the balance of the vaginal microbiome, the loss of the acidic environment, and the shift of this growth of potentially harmful bacteria, both in the bladder and in the urinary system as well. And as I mentioned before, the vagina can sort of become like a reservoir of bacteria that can cause UTIs as they translocate as well. But the gut can do that as well. Unfortunately, these microbes will move around a little bit. So we're starting to understand that lactobacilli are needed for bladder health as well as vaginal health. And then also, lowered levels of collagen can cause changes to the urothelium, so the lining of the bladder, the lining of the urethra. And this can result in bacteria residing in the bladder wall and also increase sensitivity to the pH of the urine as well. I always try and make it really simple and talk to my clients about if you had cracked skin on your knuckles and you put some acid like a vinegar or a lemon juice against it, or even into sort of washing up liquid, it's going to sting, isn't it? And you can almost imagine the bladder lining and the urethral lining a little bit, that if it's dry and it's not as plump and as robust as it should be, it can just be a sensitivity to the acidity of the urine itself. Then we might get improper bladder emptying as well. So obviously the pelvic floor and the tissue holding the bladder in place, and changes in these areas can cause issues with bladder emptying. And if there's a holding on to some urine in the bladder because it's not emptying properly, this can increase the buildup of the bacteria in the bladder. And in turn, that can cause an increased frequency of urination. And some women then might reduce the amount of liquids that they drink, which reduces flushing out of the bacteria in the bladder. And we get this sort of bad cycle happening of more and more bacteria building up in the space. Then we see BV, and again, BV is an imbalance that will happen throughout women's life. This is not something that's just around in menopause, but we certainly see it in menopause. And like in menopause, when there's a low estrogen state, we'll see it in the fertile years more around menstruation or after menstruation, when the lactobacilli are at a low point there, where they'll rise up more in the middle of the month when estrogen is higher. So as estrogen drops off, we may see a BV state appearing in perimenopause and menopausal women. So BV is just characterized by an imbalance of the vaginal bacteria. So an overgrowth of anaerobic bacteria and a loss of the beneficial lactobacillus species. So many women with BV might experience watery or gushing discharge, which might be less in menopause because there is less discharge in general, but it can still be there. They may have an unusual or fishy odor. Now, the fishy odor is quite sort of linked with BV, but it's not always the case. It's specific bacteria that release amines that cause this odor. And we may see some itching, but usually it's without inflammation. So the most common bacteria that are found in BV are Gardnerella vaginalis, Atopobium, which is now called Fanny-Hessiae vaginae, or vaginae, Mobilunctus, and Prevotella. Gardnerella vaginalis is a natural component of the vaginal flora, but its overgrowth is seen as disruptive, and it's associated with an increased risk of UTIs because it translocates as well and stirs up trouble.
Okay.
Then we move on to AV, so aerobic vaginitis, and this is sort of the next step up from BV, if you like, in a way. It's
Mm.
different bacteria that are causing the problem, though. They're aerobic rather than anaerobic. But again, it's the same situation. We've got a loss of the lactobacilli strains caused by that lower estrogen status and an overgrowth of this bacteria. So symptoms are itching and redness and an increased discharge with an unpleasant odor. It's more rotten rather than fishy.
Mhm.
There may be burning sensations because this is where we may see Enterococcus faecalis or other inflammatory microbes popping up. And the discharge may be more yellow or yellow-green in color. Not to be, we also get green with sexually transmitted diseases as well. So it's kind of working out which is which going on there. And the most common bacteria that's associated with this is E. coli, Staphylococcus, Streptococcus, Enterococcus faecalis. And then the next level up is desquamative inflammatory vaginitis, or DIV. And while aerobic vaginitis is well recognized, DIV is less common, and it's characterized by really high inflammation and shedding of the vaginal epithelial cells, so the tissue wall.
Mhm.
So DIV presents with severe itching and burning, pain and discomfort, which is all very similar to the atrophic vaginitis, but there's definitely an increase in vaginal discharge, which can be yellowish as well. But it's the inflammation and the redness and the swelling in the vulval area and vaginal area that can lead on to this. And obviously all of these need a diagnosis from a doctor
Mm.
rather than anybody else. And you certainly can't diagnose yourself with any of them. Pelvic floor issues would be diagnosed by a pelvic floor specialist, but they all need somebody to go over them and work out exactly what's going on for you, so appropriate treatment can be put in place for it.
Well, that's fascinating. I think, yeah, you've given such a detailed response to that. And I think that's also interesting. Just so for DIV, as from transitioning from aerobic vaginitis, is that because is that to do with the inflammation side of things? Because how do you kind of, was the like boundary between those two conditions?
So it's a tricky one. And again, it needs diagnosis by a doctor, and they'll
Yeah.
do a pelvic examination and they'll do a microscopic examination of vaginal samples. It's
Hmm.
all about the epithelial lining from the vagina shedding and the
Okay.
inflammatory side of it, and then looking at specific microbes as well. So
Hmm.
when a doctor or gynecologist does it, they have a sort of checklist that they go through and they're ticking boxes off
Yeah.
for specific things. But it's the inflammation that's the big part of it. So AV is definitely inflammatory, whereas BV is not inflammatory.
Okay.
But DIV is like a much greater level of
Get it.
inflammation going
Got
on
it.
there.
Okay, perfect. And then what's the difference between, because you mentioned how AV is aerobic bacteria. What is that? What's the meaning of between like anaerobic or aerobic bacteria? What is the difference? Why does it matter?
So aerobic bacteria can breathe air, I suppose,
Hmm.
and anaerobic do not. The difference is that the aerobic bacteria, the ones that we quite often will find naturally in the vaginal space anyway, the anaerobic are the more pathogenic ones that we're
Okay.
seeing. They quite often have come from the gut microbiome and translocated over. So quite often, I would say probably at least 90% of my clients at some point in their life have suffered from constipation.
Mm.
And so we're seeing issues with the gut microbiome, and
Yeah.
in turn, that is affecting the vaginal microbiome.
Okay, amazing. Thank you. And you kind of walked us through all of those issues as well. And I'd love to know, particularly for people that may be suffering with some of these symptoms, what can we do to support ourselves through these symptoms during perimenopause and menopause?
So there's a lot you can do yourself at home. And the first one, as I mentioned earlier, is opening up and talking about it. I think that's the
Yeah.
most important. Don't suffer in silence like previous generations have done, sorry. Balancing your blood sugars is really important, following an anti-inflammatory diet. So reducing sugar, eating cooked fresh foods, limiting processed foods. That's a really, if your blood sugars are balanced, you're going to keep your energy levels more balanced, and you're going to keep fluctuations within the body more balanced as well. And that's really important for a lot of symptoms that are going on there. But also reducing sugar and things like that is going to then be not feeding the microbiome with the sugars. And
Yeah.
if you're feeding them with healthy foods, lots of color, lots of variety, fruit sugar is fine. Fruit is a great source of nutrients, and I don't tend to worry about the fruit sugar so much unless somebody has like a major problem with their blood sugars. That might be a little bit different. Then you might want to reduce fruits going on and stick to the less sugary ones like the berries and apples and things like that. Establishing a consistent sleep routine. And this is not the time to be burning the candle at both ends, sadly. What we could do in our 20s and 30s is probably not the case now. We need our sleep to restore and heal. So really getting a good, stable sleep routine going is important. Supporting your microbiome, so starting with your gut, sorting constipation out, sorting out any diarrhea, working on your oral health, because we have microbiomes in so many sites, and what starts in the mouth transitions down to the gut as
Yeah.
well. Your vaginal and your bladder health as well. And a lot of this can be done with diet, things like pre and probiotics, fermented foods. Diet alone can do absolute wonders if you're not too far out of balance.
Mm.
Looking at self-care, so slowing down and listening to your body and removing optional stress. So when we think about optional stress, there's things that we cannot get away from in our life, family members, things like that we have to deal with, our job, things like that. You can't necessarily quit your job and find another one, but there's optional stresses. You don't have to say yes to everything. What must we do, and what do we actually have control over? Considering HRT in all its forms, I know I mentioned earlier that HRT can increase the risk of candida, but it's absolutely brilliant in helping to support women going through menopause. And we've got creams and pessaries for the vagina. There's progesterone as Eutrogestin, a body identical one. There's several different forms of estrogen as well, from patches to pills to creams. So, talking to a doctor and working out what's best for you is really important. Suppressing your emotions. So if you suppress your emotions, they're going to present elsewhere in the body. And this comes back to speaking out about what's going on and not burying things. Really talking about stuff that you're going through to your family, not hiding it away. And I think, it is getting better. We are, as this sort of generation, I'm going through perimenopause myself, is much better at talking to people about what they're going through. But certainly the older generation, I have a lot of clients who, don't want to talk to their family about it. They don't want to bore them with it, they say. And I'm like, no, you need to speak up about it, because they need to know that you are suffering. And once they're open about it, it's a difficult conversation to start having, but things actually start to get easier for them.
Yeah.
So listen to what your body's trying to tell you. Your intuition is key, and learning to lean into what feels right for you. So not just looking at the physical presentation of what's going on for you, but the energetics of the body as well. And this comes back to not saying yes to everything.
Mm-hmm.
So, let's just remember that many, many centuries ago, women were revered. We brought life into this world. We would have been the healers and the sages at this time of our lives, and younger folk would have come to us to seek out our wisdom. This is a normal transition, and we've lost the wisdom of how to deal with our bodies. And we now have incredible medicines that can support us, like HRT and antibiotics and antifungals. But alongside that, we have herbs and nutrients in supplement form as well. We can put back in the bacteria that's missing or could be beneficial for us. We have so much that we can use at our fingertips, and working with practitioners, be they doctors or nutritional therapists or herbalists, that can support us is really important, I think, through this time if you're suffering.
Well, yeah, I think that's honestly a really inspirational message, and I think something that's so important. And I agree, it's often forgotten. And I love that you're empowering women to take back take back that ownership of their own bodies and their own confidence and knowledge. So I think that's really great as well. And I just love if you had any last like how you would work with someone who was suffering from a condition that was maybe like intimate health related, that was related to menopause.
Sure. I mean, a lot of what I've just spoken about
Yeah.
above, we would be doing, but sometimes working with somebody, it's a lot easier for them to have that sort of, right, this week we're going to work on this, and next week we're going to
Mm-hmm.
work on that, rather than, oh, where do I start? So making sure all the foundations of good nutrition are in place, because I always think of nutrition as being like the foundation of everything. You can go and do any other healing therapy after that. But if your nutrition is not good, the building blocks of everything, that needs to be there first of all. You know, I had one client who came to me for recurrent urinary tract infections. She's menopausal, and she didn't actually have one the whole time we were together, but she left with a renewed energy and a spring in her step that she said hadn't been there for years, and she was
Mm.
sleeping better and generally in a better mood. And that was just with nutrition and a few supplements and some lifestyle advice. So, you know, there's a lot that can be done just from working on, you know, the basics. I'm always looking at the individual though, and what's important for you. What do you need? What are your symptoms telling me? And that's, you know, the key part of it is not just this sort of generalized approach, but really quite
Mm.
specific. I look at people's microbiome where possible and addressing any issues that we find there. And testing is a great way to understand where we need to bring back balance.
Mhm.
Working with probiotics and soothing herbal oil blends and ensuring things like vitamin D is optimal and the immune system is robust. I work with supplements as well as food and try to restore symptoms, balance and symptoms by utilizing those as well as lifestyle advice as well. I might use antimicrobials to reduce down pathogenic bacteria, to reduce symptoms whilst we're working on building everything else up. And I often work alongside doctors and their treatments and medications. And so, you know, what I do is very complementary to anything else that's going on for you, but it can be very supportive in terms of UTIs, vaginal dryness, vulval pain, discomfort, vulval issues.
Mm.
The thing is, you can't expect to heal overnight. So I work with my clients for a long period of time. It's a minimum of 3 months, because I see that being the shortest amount of time that it takes to make these changes and to make the foundations that we need to be secure. I do work a lot with management tools and techniques for my clients. So I really want to empower them to understand their bodies and what they need.
Mm.
Obviously, the aim is to never have symptoms again. But for many, unfortunately, if their symptoms have been there for, you know, even decades in some cases, but certainly I have a lot of people who come to me where they've, you know, had years and years and years of symptoms. And they may get the odd twinge of a symptom now and again after they finish working with me, but I want them to know that they have a toolkit on their shelf that they can use to bring symptoms down quickly. So the goal is always for them to be able to support themselves in the long run.
Wow, yeah, that's amazing. I think that's so much interesting information that I know that everyone's going to find so interesting. And yeah, I'm going to have to wrap that up super quickly. But thank you so much, Kate. That was so interesting. And I'll pop everything below.
Lovely. Thank you so much.